Hello everybody, this is Kumar Mohit. I'm a student of medicine here at University of Perpetual Health System Delta. So today I'm going to demonstrate you how to examine the cardiovascular system, means the CVS. So for the examination of the CVS, means the cardiovascular system, we have patient today with me. So what's your name? Would you please tell me your name and age?
My name is Kumar. My age is 21.
Okay, so today we are going to examine your cardiovascular system. So I'm going to examine some part of your neck and your heart. Is it fine for you?
Yes.
It's alright. So we got the permission from the patient to examine cardiovascular system. So we have the couple of the objectives for the CVS examination. First of all, we will go for the jugular venous pressure measurement, and then we will go for the carotid upstroke. Then we will go for the different type of the physical heart examination, in which we will observe it first. Then we will go for the palpation for the different kind of the thrills or the pulse, and then we will go for the different kind of the sounds of the heart, like S1 and S2, which are the normal heart sound, and due to the closure of the valves of the heart. And then for the extra sounds, which can be the S3 and S4, we will also auscultate that all. So that would be the complete CVS examination. Different kind of the murmur also we will observe, is there any murmur sound or not. Okay, so we will start with the checking of the color, the level of the anxiety of the patient, and with the clubbing and that all, edema as well. So will you please show me your hand? Okay, we have to check the nail colors as well, eyes and the face for the cyanosis examination. Okay, and is there any edema? We have to also make sure, because if there is any deficiency in the oxygen or the anemia, so we have to examine it first. Okay, so let's get started from the beginning, from the jugular venous pressure. So for that, we have to make sure that our patient should be lie down properly on the bed, and the head of the bed should be inclined at the 30-degree. But meanwhile, we don't have that kind of the bed, so we have the flat bed. So will you please lie down and make sure our patient should be in supine position. Before the examine the JVP, means the jugular venous pressure, we have to know about the anatomy of the neck a little bit. So here I'm gonna show you that we have the sternomastoid muscle here, and posterior to the sternomastoid muscle we have the external jugular vein, and below the sternomastoid muscle we have the two structure, like one in the carotid artery, which is the medial to the internal jugular vein. So internal jugular vein and the carotid artery both are the below the sternomastoid muscle, but internal jugular vein is the posterior side, but the carotid artery is for the anterior side of the each other. Okay, these are the adjacent structure found on the neck. So what we have to do, we have to just tell our patient to move his neck on the left side, and we have to make sure that we are always checking from the right side of the patient. So let's go and check it. So we have to make sure that properly, we have to know where is the sternomastoid muscle, and behind the sternomastoid muscle, or the posterior side of the sternomastoid muscle, we will have the external jugular vein. And then the internal jugular vein, we cannot see it from the outside, but below the sternomastoid muscle we have the internal jugular vein, and here somewhere anterior to the or below the sternomastoid muscle we have the carotid pulse. Okay, so first of all, we have to measure the internal jugular venous pressure. Why we are doing this? Because the internal jugular venous pressure, is indicate somewhere there is venous pressure in the right atrium. So that's the central venous pressure in the right atrium. So if there is any defect in the jugular venous pressure, then of course it's gonna be affect in the because of the right atrium some deformities. So for the jugular venous pressure, we have the two items, like one card we have, so that should be a long rectangular card, and one ruler which should be marked with the centimeters. So we have to put that ruler here at the external angle, and then we have to find out that there is a maximum pulse area of the jugular venous pressure. So jugular vein maximum pulse, and we have to measure it, make sure it should be perpendicular to the ruler. This card should be perpendicular to the ruler. So for my patient it was about 1.9 centimeter, and for the normal people it should be about 2 to 3 centimeter. But if it's above then this height is above the 3 or 4 centimeter, then it might be a higher jugular venous pressure, and it was because of the there is some defect in the right atrium pressure. Okay, right atrium venous pressure. So that was the jugular venous pressure. Now next what we are going to do, we are going to palpate the carotid pulse for the carotid upstroke. So we have to know where the carotid pulse, we have already explained about it. So for the carotid palpation, what we have to do, we have to make sure that we are not going to suppress the both the carotid arteries at the same time, because it might cause deficiency of the blood for the brain. So we should make it one by one. We have to just examine it one by one. So first of all, here I'm going to do for the right side carotid pulse with the help of our index finger and middle finger. Okay, we have to just make sure, note the rhythm and the rate and the amplitude of the pulse. Okay, we observe that, and we have to auscultate it for the finding of any kind of the bruise there. Bruise is any extra sound which is due to some defect in the valvular defect, or because carotid upstroke and the carotid pulse they indicate and the significance for the valvular defect or the aortic insufficiency. Okay, so I'm gonna hear it with the help of the diaphragm of the stethoscope. Will you please stop your breathing? Okay. Now for the right side. Alright, so we have just auscultated it, and we didn't find out any kind of the bruise or the extra sound here. Okay, so that was the examination for the carotid upstroke. Now we are going to examine the physical structure which we were just started for the examination, like our heart examination. So for that we have to know a little bit about the anatomy of the heart. There is we have the right border, we have the left border. So right border is made up of the right atrium of the heart, but the left border of the heart is made up of the left ventricle of the heart. And the anterior part of the heart, is mostly made up of the right ventricle, and the posterior part of the heart is mostly made up of the left atria, because left atria is the posterior part of the heart. Okay, so these are the borders of the heart. Now what we have to do, we have to go for the physical examination first, means the observation. Inspect. We have to first of all inspect the chest and at the place of the heart. Is there any kind of the thrills and any kind of the pulsation which we can physically observe from our eyes? So we have to just observe it properly. Now for the pulsation, we have to just properly do the pulsation with the help of our finger pads. So is there any we have to make sure that if we are just having any kind of the lift or the thrills, okay, so we have palpated this area properly. Now next step for us that we have to just auscultate it properly. Now for the auscultation of the heart, we have the 6 areas on the chest. So that 6 areas are the first of all the right area with the from the mid-sternal line. We have the right area and the second intercostal space. There, what would be there? This is the mid-sternal area, and from the right side of the mid-sternal area at the second intercostal space, we have the aortic area. Here is the aortic area. Now here at the left side on the second intercostal space, we have the pulmonary area. Now at the third place, third intercostal space. Now fourth, fifth, third, fourth, we have the tricuspid wall. And for the fifth intercostal space, we will get the point of maximal impulse and the mitral wall. So point of maximum impulse and the mitral wall. We have to make sure while we are just checking the point of maximum impulse at the fifth intercostal space, we have to take the proper rhythm of that impulse. With that, we have to also just note the diameter of the impulse, that the up to what area we are able to just feel that impulse, okay, and that we will auscultate it properly as well. So now I'm going to demonstrate you, and I'll show you that how to just auscultate all the 6 position which we have already palpated before some time. Okay, so now I'm going to auscultate it. We will going to start from the right side. This is the aortic area, and here we will able to get that S2 is louder than the S1. S2 and S1 are the normal heart sounds. Okay. For the left side, pulmonary area in the second intercostal space, here would be also same, like S2 is louder than the S1. Go a little down on the left side for the third and the fourth intercostal space for the tricuspid valve sound. We have to observe the S1 and S2. Here S1 is little louder than the S1. Okay, now we are going towards the fifth intercostal space, where we find out that the point of maximal impulse means the left ventricle apex of the heart. Here we have the mitral wall. And if there is any extra sound, then we have to just listen that sound, because might be a low pitch sound, so and we have to listen from the bell of the stethoscope. We have to also make sure while we are just examining and finding the PMI, into the point of maximal impulse, we should know that the distance from the sternum to the point of maximum impulse should be about 7 to 9 centimeter. If it is greater than the 7 to 9 centimeter, then maybe the patient is having the ventricular dilation and the ventricular hypertrophy. While we are just auscultating it, which we have already done, and if we have the diffuse apical sound, so the diffuse sound indicates that there is some ventricular dilation, means the left ventricular dilation, and if we have the sustained tapping on the apical area, and so that will indicate that there is left ventricular hypertrophy. All right, so now what else we have to know? We have to already explain the S1 and S2. These are the regular sound which we listen in a normal heart sound, but if we have the additional or the extra sound, which may be the S3 and the S4, that would be not good for the heart, means these are the extra sound. If a patient who is having any like mitral stenosis, they may just have the S3 and the S4. So we will listen that all sounds with the auscultation, okay, which we have already done with that. Now we are talking about the different kind of the heart sound, like we have a series while we are just auscultating, like S1, then S2, then S1. So the S1 and S2, the gap between the S1 and S2, these are the systolic part, and the S2 and the S1, again, that is the diastolic part. So we have the different kind of the murmur sounds. These are the defective sounds of the heart, maybe due to some structural problem in the heart, in the walls. Is there any stenosis, maybe the aortic stenosis, that would be go through the the systolic heart murmur defect. And if it is maybe due to the complete or incomplete closure of the valves, that will be also a defect and create a murmur sound. As well, for the diastolic murmur sound, we have the like in the case of the mitral stenosis, we have the murmur sound of the heart, which will be in the diastolic area, means the after the S2 and before the S1. So we have to also examine that. So here we are going to examine the two defective sounds. For the first one is the mitral stenosis. For that, because mitral stenosis we will measure here at the point of maximal impulse. So for that we have to instruct our patient that please turn left a little bit, so that the ventricular of the heart, means the left ventricular of the heart, will become closer to the chest, and we will able to just auscultate it properly. So will you please turn a bit towards the left side? Okay. So now we are going to examine for the next diastolic murmur heart sound. That's the for the aortic regurgitation. So for the AR or the aortic regurgitation, we have to just instruct our patient to just sit properly in the sitting position. Will you please? Yeah, and lean your body forward, please, so that the atria of the right atria will become in the contact, so that while our patient in a sitting position and lean in front, we have to go from the left side, third intercostal space, then fourth, and then fifth intercostal space. We have to observe that is there any additional sound. And especially we have to focus after the S2 sound, because this is the diastolic murmur sound. So if we have any aortic regurgitation, then it will be appear after the S2 and before the S1. Okay, and with that we also have some sound which are the systolic murmur sounds, and these are maybe the pathogenic as well. So we have to also know about it, like the aortic stenosis, that's the systolic sound, and mitral wall regurgitation, that's the systolic sound as well. So we have to know all these sounds which may be the pathetic and the pathogenic for the patient. So, and that's all for the cardiovascular examination, what we have been examined in our patient. Now I'm gonna to conclude the everything that what we have observed. We have examined a patient of the 21 years old, name was Narendra, and he was not having any kind of the difficulties while taking breath, and his posture was fine, and he didn't have any kind of the cyanosis. We have observed the skin and eyes as well. There is no edema in the starting examination. We have checked the jugular venous pressure, that was about 1.9 centimeter. It's quite normal because 2 to 3 centimeter is a normal range for the jugular venous pressure. So means there is no any defect in the right atrium, and we have observed the carotid upstroke as well. That was absolutely fine, and we haven't got any kind of the exosound like S3 and the S4. S1 and S2 was properly as it should be in a normal person. We didn't find any kind of the cardiac hypertrophy or the ventricular dilation or any kind of the defect in our patients. So that was the conclusion of our examination. So that's all from my side for the CVS examination. Thank you so much for watching me.